Hello, my name's Michael Witham. I'm a critical care paramedic. I work full-time for Berrytown EMS as the training officer. Uh, my project today is about community paramedicine, and it's for English 2080. A little bit about the agenda. I have a slideshow on a PowerPoint that I'm going to upload the link to. And I'll just say the slide that we're at as we progress because I'm not going to do a split view presentation here. So the agenda, we're going to talk about the problem and the need. I'm going to give ramification examples. Uh, Briefly talk about the market. Not that I'm actually selling something, but it does cost a lot of money, and there's insurances and stuff out there. So the solution that we have, the impact that it makes, the budget, as well as a conclusion, any questions that the audience may have, and then I'll list my references if anybody would like to further do any research, or you could also reach out to me too. So the need, home health shortage. So there's a nationwide shortage of nurses in all disciplines. So the one that I'm going to focus on exclusively here is home health. A quote says that it's already hard to navigate the bureaucratic hoops to get home nursing care approved. But when they do get approved, they're often told by providers that no nurses are available to come to their homes. And that story is similar for patients trying to find home nurses in Virginia. That's a quote by Baron-Poor in 2018. So essentially, ranging from emergency departments, med-surg, hospice care, home health, patients have a care that ranges anywhere from patients that need 24-hour full hospice care to patients who just need help with activities of daily living. They have mobility problems, weakness, and obesity. And a lot of the times that these patients just lack the necessary requirements to be placed in assisted living or to have home health be issued to them to come and see them at homes. So the correlation between the shortage of home health nurses and at-home injury, things that could be prevented that occur at home, like falls, medication errors, it's an apparent problem that we have in society right now. So with a growing number of elderly patients that want to live at home, coupled with the advancing medical technology that we have, medical care and medications, patients are living longer and they're living at home longer than they ever have before as well. Some patients don't meet the criteria, like I said, for home health care, while some may not be able to afford it. So with whatever possibility, the thing that I want to focus on is that there's not enough help to go around. So we're going to go to the next slide, slide number 4. Talk about the other need for EMS, emergency medical services, augmentation. So there are busy EMS services, tying up ambulances, and mutual aid response time. So I'll talk about these individually. So that's what I do full time. I work for Berrytown EMS as a critical care paramedic. And a lot of the times patients call 911 for issues that can be tended to at home, but they don't ever get noticed, or the family members or the friends don't notice it, and it sort of spirals, and then the patient ends up on having an adverse condition, like they're getting weaker and weaker, and nobody noticed, and then they fall and then they break their hip. Well, that probably could have been avoided before if the home health provider would have been able to notice the trends as this was occurring over the past few weeks or months or however long it was. So now you have to tie up in an emergency medical services. You have to tie up an ambulance. That may detract from somebody else who has a heart attack or a stroke or whatever the case may be, and then that person gets brought to the ambulance to the hospital, and then the hospital is also now oversaturated than what they would before had this preventable issue been addressed or caught early on. So the report that I wrote from, or that I pulled from my reporting services, Siren Image Trend, that's where we do our documentation, says that 14% of ambulances dispatched are to lift assists, no care required, or no transport required patients who decline care. And a lot of the times these patients end up on going to the hospital just because the families are nervous and sort of a peace of mind. They want them to go and get evaluated. So we're going to go on to the next slide, slide number 5. So the hospital augmentation. You have high patient to staff ratios already, large patient numbers even without all of these extra patients coming from home, triaging, frustration of the patients and staff members, and minor conditions that don't even need emergency services to begin with. So a lot of the times nurses and other ER staff, they're faced with more patients than what the hospital's designated to. Typically, an emergency department nurse would be anywhere from 4 to 6 patients, whereas sometimes now they're operating one nurse for every 6 to 10 patients. So this is an issue, firstly, because there's a higher probability for error when you're oversaturated with the patients. Secondly, triaging patients is challenging because every patient's there, they want their issue met, and while their care is important, they may not realize that somebody else in the room next to them requires more prompt care for their condition, and they think that they're being neglected, but they're not. They're just trying to triage, but it's difficult, and some people are left waiting for hours and hours before they ever get seen by a provider. Specific to community paramedicine, a lot of patients are admitted to the ER. They have minor conditions that could have been treated in the home setting if appropriate care could have been there to begin with to be rendered at home. A report by 2017 says that the saturation of the emergency department services is mostly due to admission of non-urgent or minor urgency patients who represent a high percentage of the admitted patients in the service. So essentially, by utilizing hospital-based or community paramedic program, a lot of these patients could have remained at home, and their medical problems could have been attended to by a licensed paramedic who functions in the role of a nurse at the patient's home. We're going to go to the next slide, slide number 6. So my project description, what is it? It's a gap bridge, basically to augment the shortage of home health nurses and to supplement the oversaturation of busy emergency departments and ambulance services. So a report says that for the first time by 2034, individuals aged 65 and older will outnumber children younger than 18 for the first time in modern history. So community paramedics are here to bridge the gap by offering home health services to the ever-expanding cohort of elderly individuals at their houses, identify the individuals who are at risk or who don't qualify or can't afford traditional home health services, and maybe the ones that just require minor assistance, like assistance ambulating or assistance with medication. And those things might just be too tedious for, for example, you have an 80-year-old couple and it's just the husband and the wife has vision problems or hearing problems. That care might be just a little bit too much for her to handle by herself, even though it doesn't meet the requirements for home health services. So we're going to go to the next slide, slide number 7. So how does it work? State employs community paramedics through the Department of Health. They work mutually with the hospitals. They have a district medical director, so an MD or DO, and they have a state-level director of nursing programs manager that works at the Department of Health. So basically, these patients they'll identify the at-risk patients, the ones that don't meet the requirements for home health services. They'll be dispatched to assist those residents on a regular schedule, and this will all be sort of oriented and coordinated through the medical director and then the programs director. And so they'll be assigned these patients by the providers, and they'll go there and they'll do whatever they need to do. They'll follow the physician's orders. They'll take the vital signs. They'll report back to the physician, and they'll make changes as needed depending on what the patient's care, how they're trending. And this could also prove beneficial to address the overuse of emergency departments and ambulances and augment the shortage of home health nurses that we have, which would save money in the long run. Expert opinion says that capturing the patients that are not eligible for home health is one of the biggest things that community paramedics can do. Additionally, the community paramedic can regularly see them, the patient, and they can do screening exams and wellness checks to try to indicate if there's a chance that the person's health status is changing, and then they can identify an adverse event before it even occurs and help save money and time in rehabilitation and morbidity from it. So we're going to go on to slide number 8. So how does it solve the problem? Less patients have adverse health reactions or events and for things that are preventable. There are less calls for assistance to 911, less hospital visits, nursing home and urgent cares, they have less visits as well. And then also the community paramedic will teach patients and the family member of the condition, and so the family member will become more involved and oriented in a patient's care. So the use of community paramedics will assist individuals who don't qualify for the home health services and they wish to remain autonomous at home. They'll augment the shortage of home health care nurses that I talked about in the beginning and the burden placed on EMS and ER staff members, which will overall lower healthcare costs and improve the quality of life for these patients. We'll talk about the budget, which is on slide number 9. I'm not going to go into detail about it, but essentially the total estimated cost for a year is $600,000, and that is with a very generous miscellaneous spending supply. That is on slide number 9 if you wish to look at it. In conclusion, by adding community paramedics who function in the role of home health nurses, the shortage of home health nurses can be augmented. It'll help patients living at home for minor care. It'll help augment the busy ER services and busy ambulance services and help to save money overall. I have on slide 11 here a CP home visit flowchart. I'm not going to go through it, but basically if you'd like to look at it, it sort of summarizes how a typical visit would go, getting the order from the physician, going to see the patient, documenting, and then making any changes or adjustments as needed. So I have references next on slides 12, 13, and 14. Other than that, this concludes my presentation. If there aren't any questions, I can be reached by email. My email is at the beginning of the PowerPoint, and I hope everyone has a good day. Thanks.